Hello, everybody. Happy Black Pride. We are here at our first official event, which is an open conversation and dialogue, which is our health as a human right event. This is an event that we do absolutely every year. We make sure that we discuss what's happening for our LGBTQIA, people of color community. So today, the conversation that we're having, since we're in this age of COVID, is we want to talk about how in our community are we navigating sex? How are we navigating dating? How are we dealing with that on top of being safe around HIV and AIDS, and also trying to be safe to, stop the spread of this disease, this COVID-19, this coronavirus. Having a lot of conversations with people in the health department, sometimes I think that they tend to forget that people in our community are still having sex. Despite whatever is going on, people are still meeting, they're still engaging and doing something. It's not realistic to think that in the last 5 months, no one's had sex. Nobody in the LGBT community has been having sex. So let's really talk about it. So as you can see, we have kind of a diverse panel. I'm going to apologize up front. There was 2 women of trans experience who kind of pulled out. So I don't want anybody hitting me back later saying, where was the trans representation? They pulled out at the last minute. So I'm opening this up to everybody that's on the panel. We're gonna have a real talk conversation. Most of you are I'm sure all of you, have had sex since March in one form or another. I'm not sure how you all are engaging around dating. I'm not sure how you are navigating your life. So let's talk about it. Let's talk about you supposed to be in COVID and wearing a mask and wearing the gloves and social distancing. I don't know how you social distance and have sex, but we're going to talk about that today, right? So I want to start with and get the floor first to Suella, and we all going to jump in there. We're going to let the ladies speak first. Suella, how are the women navigating dating and sex during this age of COVID? What's going on with the ladies?
I mean, we are still okay. So those who know now, I'm not dating like I used to anymore. I'm in a relationship, so it's a little different. But dating is still the same. Women are still meeting people at different locations instead of still social distancing. They're still wearing their masks, their gloves, and I guess based on the velocity of them getting to know each other, they go to step further. I mean, I know a lot of people linking up. They link up with people, they go out on dates, and they hook up with one another, and with no strings attached.
Are there social sites for women to hook on? Like, the guys, we got Grindr and Adam for Adam. I'm a little outdated, but we got sites.
Well, I mean, they're still using the Tinder, I believe it is, and there's another one. It's on the tip of my tongue. I think it starts with a P. I actually used it myself at one point. But people are still meeting people. It's not, COVID didn't stop it. It did slow it down and made people a little bit more conscious. But they still bumping.
They still bumping. They still getting it in.
Mm-hmm. Yeah, there's a lot of licky, sticky still going on. I like a sticky too. So, I have the little, my lady, she uses her strap. So, yeah. So,
okay.
I want to give it up. We getting raw, right? We grown. We grown. Right.
Okay, but I mean, so when your lady friend is coming over, I mean, you're not scared of COVID?
No, well, because, okay, so what I can tell you, my personal, for me, we make sure we don't actually go out of different locations, and we make sure that we are constantly conscious of where we go in and what we touch it, and making sure we wash our hands on a consistent basis. So I can actually say, and this is also a trust factor, I can actually say that we are not exposed as much outside.
Mm-hmm.
So we go out, come back in, and then she go home, I go home. We meet up, we link up. So we only around each other the most part. And if we are around, like I went to Jersey, you know, we try to do as much as you can. I mean, despite of circumstances, like I ain't really going nowhere to get involved. I work from home. She works from home. So we still getting it in.
Okay.
Love is love, darling. Yes.
I know, but you still gotta travel, so you still gotta touch things. You gotta get on the train.
No, gloves. I keep a glove. I don't touch doorknobs. I even when I went to Jersey, I had lace gloves. Yes, I don't touch nothing. No, nothing touches my fingers. They special. They can only touch certain places. Yes, darling.
Okay, all right. Anybody else want to
But
talk
I saw you, John.
Huh? Anybody else want to add to this conversation with your group?
I'm curious because for me, I will have to say that I was very much afraid of this whole COVID thing. I was diagnosed with actual AIDS, so for me, I can't have my mom lose a child to this pandemic or another child. So I will have to say that I was actually quite scared about inviting anyone into my home that I did not know. Even my fuck buddies that I have, it wasn't like at the very beginning, New York was like the epicenter. We had like so many cases and people dying. In Central Park right there, I would go in the morning and I saw them putting bodies in freaking vans. So it was like, I saw that and I was just like, okay, nobody's coming to my house. I'm not going to nobody's house. This is like for real. As things have opened up and testing has come around, I did not invite any of my fuck buddies until I got tested and they had to get tested themselves. It wasn't up until that. So I really waited quite a bit to do anything sexually.
How you know they got tested? Because they told you they did? You believe them?
No. These people I trust, okay? These are people that I've been like, they're fuck buddies. They're also friends and fuck buddies for, life. You know what I mean?
Okay.
I trust them. We trust each other. We talk about STIs and things like that. So these are people that I can call them up and be like, hey, I got gonorrhea. I think I may have given it to you or not. And we know it's like, it's that kind of closeness. It's been years of like going back and forth. We're just not in a relationship.
Okay, all right.
I think with going off what Jeffrey said in the beginning, it was horrible. And in New York, like, people were mortified. Like they didn't know what to do. We didn't have the right information from our government. We didn't know like what was going on. But from experience and from asking around, like the sex never stopped. If anything, because everybody was quarantined, the apps were popping. More popping. Everyone was in their house. Everyone was now all 100 feet away on your grid, so you can go upstairs if you had to. Like none of that stopped. But what I noticed is that different people had different procedures. Like when I would ask around, they were like, "Oh no, if so and so coming over my house, as soon as they come in, they gotta take off their stuff. I'm giving them hand sanitizer, making sure they got gloves. We having a conversation about who you been, where you been, did you get tested for COVID, and then what else you get tested for." It was like each house had their own protocol, right? I thought there was instance.
Let me just interrupt that. So basically, before you had sex, you had a whole interview process. The person comes in, you handing them gloves when they come through the door, and you start interviewing them.
Gloves coming in, gloves. I need some extra masks. I got all that for you, so I'm like, oh, maybe I should implement my own protocol. Be like, come in, go straight to the kitchen, wash your hands.
There should always be a protocol. What are you talking about? You should always have a protocol.
You didn't turn sex into a fetish. You like, okay, I'm gonna make this work to my benefit. You
Put on some leather, because you know leather's a protection. Put on your leather mask, your leather, put on your whole leather cow outfit.
Oh, like this.
a cow outfit.
The chaps, all that. Just all the rubbers. Your whole body in rubber.
Okay.
And that's some people's protocol. They was only having leather sex. Okay.
And I imagine you meet them at the door with your outfit already on.
Oh, see, me? Today I'm speaking from not from I statements. I'm speaking in general what I heard.
Really? What you heard?
Come on, we grown here. We grown. Come on now.
Right.
No, let's be real. Because at the beginning it was just like I did not do anything, but then.
I'm sorry, your sound is in and out a little bit.
It's a signal.
Yeah, I think his signal's a little weak. Oh. Jose.
Yes.
How's your sex life?
Not very good.
Obviously, a lot of hand sanitizer.
I've actually been. Sorry.
Yeah, continue.
Yes, go ahead. Okay, you have faded out there, so we lost you. Go ahead.
Yeah.
I'm sorry, Jose. Let Jeffrey finish what he was going to say.
Okay.
So I had I have I don't know how many tubes of alcohol. I spray everybody and things like that. Obviously, I didn't kiss nobody, and things and that kind of that's how I protected myself the most. But as this is going on more and more, I'm less and less into the whole sexual aspect of anything.
Okay, I want to back you up a little bit. You just said when they come in, you getting ready to have sex, you start spraying them down with alcohol.
That's why I was here too.
Shit is burning and stinging before you even get started. Oh no, honey.
That's why I was kidding. I was like, oh shit, wait.
No, I can show you the bottle. Look.
I'm not doudting you. I'm just saying.
It's the fact that you spray them on arrival though.
Right.
On arrival.
Say, pull your pants down and let me start spraying. Oh my God.
But that is because of the trust factor.
It's like going through a hazmat.
But that's the trust factor where people been. Gotta do something.
I can't trust where they've been. They just got in an Uber. Who knows if they grabbed it in that Uber? I don't know.
I think that's definitely valid. I would rather direct them to the shower. I don't know necessarily about spraying them down with alcohol.
No, I spray them down. I'm like,
shower scenes are always right. If we're talking about protocols, that is one of the protocols for me. Stuff off at the door, straight into the shower.
Mm-hmm. Yeah, that's the same thing. Me go to the bathroom. You're right. I sprayed the company down, but no, my girlfriend no. Go to the bathroom.
Oh, I gotta spray them down. I just don't feel like. I mean, my mom has cancer. She's going through chemo. I mean, I have people that I have too much to lose to lose my life or be sick or to cause stress on other people in my life. So I'm like, no. I'm not gonna risk it. And that's why as this thing has opened up more, I've had less and less sex. Now I have a lot of conversations. I'm like a lesbian on the phone, basically, getting to know people.
We having sex too. Wait a minute. Okay.
No.
Lesbian.
I'm just talking about, the stereotype of a lesbian.
Is that the stigma? Lesbians don't have sex?
No, it's not that y'all don't have sex. Y'all just the stereotype that he's talking about is that y'all communicate better. So in other words,
we are more intuitive. Yeah, I agree.
In that sense or whatever. So he's saying he busted it open, but at this moment or whatever, he slowed it down and actually have conversations before doing so. Which sorry for those out there. Hi, what's going on?
Yeah, no, thank you for explaining. It's they call it lesbian sex. It's like a lot more communication and a lot less physical interaction.
Okay. Because I don't know. That's a little scary to do with burning people down with alcohol, honey. Woo.
No, what you mean? Why?
No, drop your pants. Let me spray that just to make sure it's sterilized.
Everything.
Mm, mm.
Ultimate Febreze.
Okay. All right.
Febreze, soap and water works for me. I just saying.
But I'll be honest.
Yeah.
It was tough because I'm gonna tell from my perspective of how it was. Because some of you already know that within COVID, I lost my mother. Within that time, I can say I was dating. It was just two people. And the way that when COVID came in, I didn't have my mind right. So a lot of things I wasn't thinking of too much because from me not dealing with this of losing a parent and especially my mother of being so close to her, I knew that my mental status on things at that time was not 100%. So on me wanting to have companionship at that point, I lost a little bit of what I would normally do. So my main thing is the two people that I hung out with, that I actually had sex with, I was in very constant contact with them. Facebook, Instagram, and also I was a little okay knowing more or less what they every step was. It kind of was a little stalkerish, but me not wanting to just believe what a person's going to say, I want to see the actions as well. So you telling me you were here, you're doing this, the receipts were there, so I could be okay. As far as I can't remember who said earlier, of how a person can come when they're coming in transit to you, you can possibly get it there. That's when it comes in, when they come through that damn door. Strip all down, sanitize, go shower, then I feel they're okay.
Protocol.
Okay, it's good.
So I'm gonna say you guys are not really taking into consideration that there are a lot of people that are walking around that are asymptomatic. They're not showing any symptoms. So you could put them in the shower and do all of that, and they still could be positive for COVID.
That part, I didn't consider and think about that until towards the real ending when things started to open up, like around between phase 1 and 2, because it wasn't really nobody talking about antibodies and asymptomatic. It wasn't really a talk about it. That all started coming at the end because knowing all through this, nobody knew what the hell was going on. How we were getting this, where it was happening. One thing I know for me, and I'm sure a lot of y'all knew, we knew where sex was definitely going on. There were sex parties that were going on.
And
there were sex parties that were going on. I mean, there were group things, a lot of stuff. I mean, it was like when COVID came, it's like it opened up a little bit more. But in my community, they just didn't care in a way. Some just didn't think it was really. It's like, put it like this. I think a lot of gay men, because they couldn't see it, they didn't care. Are people around them not sick? They didn't care.
Well,
and that's the insanity, I think, because it's like that, and it's still that same way. It's a lot of gay men I know that don't think about those parts, but just go right, and I don't know.
I don't know if I agree with you.
Right. I don't think that it's a gay thing, because there are people among so many different social groups that, you know, feel the same way or don't feel the same way. I think honestly, what we're really talking about, you know, as a person living with HIV for myself 20 years and living within a pandemic, within an epidemic, is how my world is formulated right now. Talking about sex has always been a normal conversation with me. Some of these practices, and I'm saying that people want to do all these protocol and procedures when it comes to COVID, but there have been STIs and STDs have been in existence for all along existence of time. And so now somebody coughed, now you want to wear a hazard mask, yet alone STIs and STDs are still running rapid within our communities, right? So we want to talk about where do we assess our risk, and where do we value ourselves? And I think that a lot of this conversation, because of the mass deaths, now it's circulating like, I value myself more because I don't want to be one of those numbers. But the HIV and AIDS rates have been a consistent high, being risen high amongst Black men, Black young gay men. And so to see some of the conversations that I see that saying that, you know, people care, people don't care, I think that people are just reassessing where they place value on their lives, versus because we have been dealing with HIV and AIDS for so much years, and that it became a nuisance to see an HIV testing van, someone giving out condoms, and when people say they want to live their lives. Now you have COVID and saying, wait a minute, I want to re-strategize protocol and procedures. I think that, like, you know, that's where I'm saying, like, a little bit of scratch in my head, but I understand and I get it.
So do you think that while people are dating and they're meeting, do you think that they have put HIV prevention, PrEP, and all these things now have become secondary parts of the conversation? Because right now, everybody right now is pretty much more focused on the mask, the gloves, the alcohol,
Everybody,
the
most
hand
people think
sanitizer.
most people think that every sickness is COVID. That's what I think.
Well, I think that, you know, so again, like you said, Quest, like our government officials, like so much different information is coming down the pipeline. And then also part of the conversation is that a lot of us have not had access to our providers, let alone to be able to get an STI, STD kit. Fortunate now, there are a lot of now nonprofit organizations that are now offering test home HIV kits and STI kits, just so that you can be able to keep up with your sexual health, because you probably don't have access to your medical provider, which brings another level to what we're talking about, right? Because if our providers are not access to us, but we still engaging in maybe high risk, low risk behaviors around COVID, not knowing if you're putting yourself at risk for COVID or an STI and STD, and then knowing that before COVID, if you did have unprotected sex, there was a list of organizations and doctors and clinics that you can go to. Now, if you have put yourself at risk, you can now get a COVID test faster than the STI or STD test. And that's what we really, you know, really need to talk about, because it's like, I know I put myself at risk for this, but what about these other things? And what am I supposed to do? I know that there are options for us, but they're becoming smaller and smaller while we're focusing solely on COVID.
Can I just interject on that very quickly?
Yeah.
Just piggybacking on what Jalov said. It's very interesting though, because everything is COVID, and just like you're saying, the resources for everything else seems to be diminishing. I mean, it's like cancer doesn't exist anymore. Like people don't have diabetes. Like people don't have heart conditions. You can't just go show up at a hospital unless you go to one of these urgent care units, which are pretty much secondhand, because it's kind of basic, the examination that they give you, but that's the places where they send you to. To get an appointment with your doctor, I mean, all the males in my family have died from prostate cancer. So every year I have a prostate exam. It's been like, you know, routine at this point, because I don't want to, you know, if I can catch it before it happens, great. I was supposed to have my exam in June. Mm-hmm. My appointment was canceled. We'll call you back to reschedule your appointment. I call back in July. We'll call you back, or we don't have it. Everything is because of COVID. But, you know, the rest of the people are still experiencing all these other, you know, illnesses, but they're not focused on that because of COVID. They finally called me now in August and gave me an appointment for the end of September.
Wow.
And that's pretty much the mentality now. Wow. Everyone is so absorbed with COVID, that everything else is kind of becoming second nature at this point.
Yeah, now, it's becoming a non-factor.
Yeah, I was gonna piggyback off of that as well too. Someone who also does work in like the sexual health or HIV field as well too, like a few people here. But make a long story short, so the organization I work with is AHF, which is a healthcare center globally rather, nonprofit healthcare center that deals with HIV. And the part that I see as a struggle now, because me as a linkage specialist, I help people get into the door. I've noticed that during and even after COVID, even all of those things reopening and things of that nature, referrals have been very slow when it comes to like trying to link people with HIV. Reason being, Department of Health is very limited. That's both with the sexual health clinics and ACE, or the field service unit. Field service unit is like working from home at this moment. There's issues with like VPNs and things of that nature, whatever the case may be. They're not able to even like really reach out to certain people to be like, hey, we need to get you into care. When it comes to outreach or whatnot, what are we exactly outreaching for? Other than the virtual platforms, the outreach scope is very much like almost not to a point where it's non-existent. So to even get those conversations surrounding HIV back to a certain space has been a little, like, definitely difficult. Not even a little bit, definitely, so to speak. Because I'm also seeing, as much as we are out there, at least I know my organization is out there, we've been doing the thing even while COVID was in shit deep. Like we've been open. We've been trying to take care of people both remotely, where we was doing like virtual visits or referring people to other lab places or whatever. Now, even though we have space to bring people in, it's because of the rest of the world literally shifted this thing to COVID. So that really is kind of like it's the unfortunate part, where while we do want to holistically think of things, and it does beg the question, how do we get this important status such as HIV, not even back to the forefront, but just a reminder that this is something that people are still living with, that people are still disproportionately being diagnosed with, that people still don't even know their real resources for, unless they like, are rich and wealthy and a certain other color that I'm going to be honest with, because we know systematic racism is a real thing.
Yeah.
Just being upfront, so with that being said, that's the huge challenge. And it does frustrate me, because I know I've gotten into this work to help my population, me being somebody who's HIV positive for the past 10 years. And I've seen what like navigating those services is like. So I wanted to help my people out get to those services. I wanted people that look like me, or that like, either Black, cisgender, transgender, whatever the case may be, get into those doors to get to a place that I know is capable. But we can't do that at this moment. It's just an overshadow, and we're not making this as holistic as it needs to be. So this is why we're having this conversation here, because we do need to tie back in. Yes, while we're dealing with COVID, people dealing with HIV, and it's all like at this moment it's very much happening simultaneously. How do we get that balance back?
Well, Jalab, you want to go, or?
Yeah, well, look at our HIV Starts With Me spokesmodel. I'm an HIV Starts With Me spokesmodel. I just have to shout out the statewide campaign. But I think that if we're talking about protocol, within the transparency is that these nonprofit organization hospitals, our economy, our government didn't have the protocol for a global pandemic, which already, if you're a marginalized community, was going to impact us on the highest top level. And that is also part of the conversation, that we didn't have the protocol for this, right? But now we're making protocols for our sex life, which is A-OK. But let's not forget about STIs and STDs, right? I think this really reminds me of like now this being an HIV positive person, the high stigma against dating somebody who's HIV positive, right? I was asked 6,078 questions, and now I get to ask you 6,078 questions when it comes to pertaining like, where have you been recently? Have you traveled out of the city? And just, have you got a COVID test? Because these questions was asked to me. And I don't want to say like it's a payback thing, but it's again for us to remind ourselves that we're all human, dealing with humanizing experiences, and don't humanize somebody based on their health status. And I've been seeing a lot of that happening with COVID that remind me so much of HIV.
So let me.
Can I say something?
Go ahead. I'm sorry.
Hey, I have to leave, as I told you all, but I want to say thank you, Lee, for putting this together.
Yeah.
Thank everybody for giving a great insight. Y'all know I'm all of y'all biggest fans. So I just want to say I'm heading out. I got a photo shoot to go to, but thank you. It was nice talking to y'all.
All right, have a good one.
Love you.
So I want to kind of put a little human factor back in this, and then I'm going to try to go to someone who hasn't spoke, which is Christina. But I want to say that I think one of the things that we not really talk about too is the impact of being in lockdown. We were in lockdown for quite some time here in New York, right? Because we're here in the epicenter of of COVID for quite a while. And I know that, you know, I was receiving tons of phone calls after I had came out of the hospital, right, from dealing with COVID. And I posted my situation and what I was going through in my recovery process. Then I started getting tons of emails and tons of support letters, but I also started getting people hitting me up saying how greatly depressed they was, being in the house, dealing with COVID, not necessarily having the resources or money, right? People still got to eat and navigate how to just have their day-to-day normal life. And so I'm kind of going to go there with a couple, I'm not going to name names, but I know that one of the people were saying to me that because of their depression, they began using drugs, right? Reaching out to drugs to fight the depression, or the depression was bringing them down to using drugs. And therefore, then they started to take more risk and go out there because of feeling alone, and kind of in that place and space where they just wanted to feel, whether it was temporary or not, loved, or the touch of somebody else, because we all were in some sort of isolation. And so I started to kind of look into that, and I started to call a few places that I know, and started to find out that the suicide hotlines numbers were increasing there. I was really surprised to hear that domestic violence numbers were up tremendously. So with that being said, I really wanted to have this conversation because I feel like through all of these other things that were happening in people's lives, despite supposedly being in a form of lockdown and isolation, we still was finding a way to network and meet people and engage in some kind of sexual interaction. And so, you know, how do you guys feel about that? Have you run across people that who are well aware of the risk, and some of them have honestly told me, you know, they did some things that were risky. I was surprised to hear about how many sex parties were up and thriving in the last couple of months. So it is what it is, you know.
Well, I want to talk about. Is somebody saying something?
No, go ahead, Christina. You give me a perspective.
So I want to talk about two different type of people: the 30 and younger, and my trans girls. So the 30 group and younger, they really, some of them, because I'm not going to say most of them, because I was really kind of like not involved, but knew about it. They was not even worried about the COVID. They was really in it. During the epidemic, during the lockdown, they were still having their friends come over, having, you know, things, even having sex, you know, no worries whatsoever. They still was going with their life to day basis. Okay. So that was like, you know, during that epidemic, it's like everybody's trying to worry about, oh, be careful with this, be careful with that. They was not even thinking about it, you know, and stuff like that. Of course, some of them did get it, you know, and they still went on, not mentioning to other people that they had it. You know, sometimes they did mention, but only to their closest friend, you know. And to that perspective, going to my trans girl was still working sexually, making their money, because they didn't know what was going to happen. So there was some of them still working during this epidemic and during this quarantine time, trying to make their money because they didn't know what was going to happen. Where was they going to get money from? Where was they gonna? What was they still got to pay for apartments. They still got to do this. They still got to do that. They were still working
Yep.
up
Well,
until
I'm gonna,
now. And we talking about masks and stuff like that. They only wear the mask was outside in the public. When you came into the domain and stuff like that, did the people oh, let me spray you down and stuff like that. No, there was none of that. It was a risk they were all taking.
yeah,
A risk that was all taken today. Yes. Do I feel now I'm going to take it on me? Do I feel, yes, I was locked down for 3 months and I was wondering, okay, well, what's going on? What's the thing and stuff like that. But then I said, okay, I got to move on. I got to move on. I have an itch. So I decided to go bird watching.
no,
You
I'm
know,
gonna chime in. I'm gonna chime
Really?
in for 2 reasons.
That really helped your itch.
I'm going to chime in because I am a former sex worker myself. I still have a lot of friends who are still in the industry, friends who are very close to me. The thing with why a lot of sex workers continue to work even during this pandemic is because you cannot go to unemployment and get that extra $600. Now it's $400. There is not that option. You are a sex worker. You do not have that option. So I'm going to come to their defense. I'm sorry, but
No, it's not about defense. We're not
I
judging anybody. We're just trying to understand that there's different types of people for different
you
reasons.
know what I mean? Like, they still had to pay their rent and everything like it, just like everyone else. And of course, because they've been doing it on their own for so long, they're not in many services or anything like that. Looking up agency, I have friends who had to eventually get on state assistance and things like that because a lot of the clients got fired or were out of work. So when it trickles down, it goes from the clients that paid no longer are working. They're at home. They're surviving, but they don't have that extra discretionary income to hire an escort or a sex worker. So they continue to work because of that reason. And then the other thing that I wanted to say, there were several key issues. We were talking about how COVID has taken over this whole pandemic, has taken over, and HIV has taken a back seat in other illnesses as well. What I wanted to say about that is that the way we address this, if we're, like we're meeting here to find solutions, the way we address this is that our government has allowed this to happen. How is it that the United States of America has 23% of the world's population? No, it has 5% of the world's population, and it has 23% of the world's coronaviruses and deaths and everything like it. I don't know the exact numbers. This is just going off the top of my head. It's like, this is, and it is not a third world country. It is a superpower. So our government has not addressed it correctly. So now I will have to say that the actual healthcare industry has poured all their resources into this because this has become a big crisis. This is not, to have 5 million cases in this country. Canada doesn't even have that many cases. It's just unbelievable. So I understand the way we are going to address this is by electing the right kind of government, because until the head changes or we cut the head off, nothing's going to happen in that regard.
Well, Jeffrey, let me just
wait. Did Christina finish her thought?
Yeah, I'm getting ready to pull back to Christina, but I want to say this. Yes, the government definitely has to take some responsibility about the epidemic and the spread. But the conversation we're having today around sex is, I think that we all have to take ownership of our own sex life, our own behavior. The government is not necessarily dictating that. We make choices, and we need to be responsible for our choices. And this is not about a judgment situation, but we all make choices. And if we make risky choices, we also got to take responsibility for that as well. But I did want to circle back because Christina touched on bird watching. And so do you want to tell our listeners what bird watching is, Christina? And do you want to explain to us how, when you were bird watching, what did you observe?
Well, first of all, my bird watching consists of a workout because during this epidemic and the lockdown, I gained a couple of pounds. So I decided to walk my way to the birds. So, bird watching is, when you go into the park, well, I live by Central Park, so, so I walk towards the ramble. And I go and I be nosy.
Is there lots of birds? Is there lots of birds?
Yes, there's sorts of different color, different sizes. Some make different noises, But I go in there and it's amazing to me how they don't have a care in the world because they're still in there follicating, doing this done. And it's not like, oh, one-on-one. It's like 8, 12.
Really?
In one, okay. No, when my hours 5 to 8, please don't come during that time.
Oh.
Yeah.
Because I live on the other side. I live on the east side. So I went up the Rambles because I like bird watching, but real bird watching. I mean, like the ones that fly, the ones with wings. My feather.
Hey, Jeffrey, you scared me because if you were in the Rambles bird watching with the alcohol spray, honey, I don't know, you're gonna be living.
But does it make sense? To me, it makes sense, and I don't think the proper verbiage is like no care in the world, because if we're talking about some of the correlation between HIV epidemic and COVID pandemic, right? A lot of us, had to have learned how to, reformulate relationships, feel sexy again, have sex freely, understand that there are risks. And still wanted to continue our lives. And when some of this, some of the things that we're seeing with COVID is so reminiscent, it's just like, been there, done that. Don't need another something to put me back in a place that I don't feel sexy again, that I shouldn't have to have sex, that I shouldn't, be out there, because it's just part of some of our norms and behaviors, right? If everything is being shut down, your form of thinking is just like, maybe there's gonna be more people out, maybe there's gonna be more catch to catch, because it's something that, yes, COVID is something that we've never dealt with, but have we dealt with an epidemic? Yes, we have, and still are. And so if that didn't stop me, I already contracted HIV and I'm still living a long and healthy life, and there's barely information coming down, and it doesn't seem as serious, but I know the deaths. It was the same thing that they were saying about HIV.
Well, I'm going to piggyback on that, and I'm actually reinforcing that thought, because I remember in the days when I was barebacking and just like doing my thing and so on and so forth, and I was still getting tested. You get what I mean? I was getting tested, and it would come back negative, and I was playing Russian roulette, and it just kept coming back negative, and I just kept going. And so it's kind of the same mentality. Okay, I keep interacting with different people, and I haven't gotten the symptoms of COVID. I don't have the fever. I don't got any of this. So maybe I'm asymptomatic. Maybe I'm immune to this damn thing. You get what I mean? It's like in your head, we like to fool ourselves that we are immune or we are Superman to the illness. Because that's the way
do you think that some of the risk adds to the excitement of what you're doing?
It might. I know that when I was barebacking and I was like, oh, I'm mostly a top, and every now and then I bottom, and he doesn't come inside of me. But it was just the thought that maybe one drop came in. I don't know. It made the sex better. I mean, I'm being very honest with you. I wasn't like a bug chaser. I wasn't chasing the HIV virus, but there was something inside of me that walking that thin line of where I could fall or I could keep walking made it more exciting. And I'm going to be very honest. I was what, 22, 23 when I was walking that thin line.
All right.
So
Well,
yeah, I guess it does add to the excitement of just going out there and being like, yeah, maybe I am Superman. Maybe I am Teflon. Nothing sticks to me.
But I want to.
And
Christina, what was you gonna say?
Oh, I want to say something. Well, not piggyback riding, but saying something into that effect too. Is that these young kids now say, "Oh, I'm undetectable," and the other one say, "Oh, I'm on PrEP." They still go ahead and do it raw anyway.
Because they believe
Like,
that pills save them.
like
It's a lot of these young kids that don't get educated like they should. Instead, and we don't, and on top of it, there are a lot of adults. Go ahead, say what you gonna say, Joe.
Yeah, so
Go ahead.
No, I would say, well, you know what I'm saying, like what being sex positive, right? So with the science there, right? If I'm on my HIV medication and I am scientifically undetectable, which means I cannot transmit the virus to my partner, and my partner is on PrEP, where is the risk, right? So we were talking about risk. Where is the risk if there's no risk of transmission if each person is taking the responsibility for themselves? Now, if we're talking about if one or the other party is not being honest, now that is a different conversation. But if we're talking about if someone is actually on their HIV medication and they have maintained an undetectable viral load and their viruses and their partner is on PrEP and have been on a scheduled routine and been taking it consistently, and if they're in a monogamous relationship, let's just throw that in there. If they are in a monogamous relationship and they're engaged in unprotected sex, there's no risk of the transmission of HIV. Now, other STIs and STDs, that's a different story, but HIV directly, no. And so, biomedical
COVID, so you still got to deal with COVID. You could take all of the PrEP and the meds that you want, but that's not filtering out COVID.
Yeah, but we was actually, because Ja basically was going to Ja hit the nail on the head of exactly what I was going to say. In the instance of, when it does come to HIV stigma as well too in general, we had to remember scientifically now the information about being undetectable is not transmitting. The danger comes within it where if someone who's assuming they're negative, has not been getting their HIV test, not following up in that sense or whatever, they probably have contracted HIV, but because they're not on a regimen or they're not on an ARV, so to speak, and they have not caught it, that is the danger or the risk rather of the contraction. Or on the opposite end of the spectrum of somebody who may say that they're on PrEP, but if they're inconsistently taking their PrEP, as we should know, rather. I'm not going to assume that every single person in the world knows this, but you could take PrEP as consistently as you want. You miss 3 days, that protection is done. Yes. Or the medication may have gotten better, like outside of Truvado, maybe because the Scovies on the scene. But overall, 3 days, it metabolizes out of your system. That barrier is done. So if you have that mix, like if someone's not doing what they need to do in the mixture, that's where the risk can come. Now, consensually, if you have 2 consentable adults, one, once again, is on PrEP in a perfect world, consistently maintaining their regimen, and you have this person, as Ja already mentioned, that's undetectable, taking their medication, and scientifically we know there is no transmission, you're fine. Like, you're virtually...
And tying it back to COVID, it is applying the same kind of rationale and the mentality and the sense of responsibility within each individual. That is how we're going to diminish this pandemic. I mean, like, yeah, it may seem irrational, me to spray somebody down at the door. But if that's what it takes, if you don't want to, then there's the door, and you can keep it walking. Keep on walking, because I got my toys, I got my goodie drawer.
You make them keep them. You make them.
I wanna say something that before I forget.
I'm gonna piggyback off that too after you, Chris. Go ahead.
Okay, so I was piggybacking off the other person saying that about the HIV and stuff like that. Well, most, and I'm going back to the younger people, most of them lie anyway. Okay,
I am going to say
could be.
Don't say the younger people, because I know a
Well,
lot of younger people that are very responsible.
I am saying the 30 and up because I am around them and know them. So that's why I said it. But I'm sure there is the older generation do it too. But I want to speak about
Hell yeah.
that particular thing, because we already lived. That new generation that are coming in are just going rampant. You know, we, the older generation, had people to guide. This new generation don't want to be guided. They're just going. So that's why.
I'm gonna just interrupt there, because we cannot generalize in that sense, because I know a lot of younger people were very responsible. I mean, I consider Jalab younger than me, way younger. And he's my teacher. So I mean, like, I'm dead. Come on. I know a lot of younger people who are very, very responsible when it comes to their health. London, that was just here, he's very responsible with his health. I mean, like, I know a lot of younger people, my nieces, my nephews. It all takes education and being open and transparent. If you're transparent with them, they'll be transparent with you. If the younger generation is learning to lie, they're learning it from the older generation that are lying.
Well,
I'm
let me back up. I
going
want
to put it out that way, and I'm 43 years old. So
Let me
and there's a lot of us out here saying, oh, I'm on PrEP. And I mean, like, girlfriend, you were on the old HIV medication. I can see it everywhere. You get what I mean? Like, you have the gauntlet, you have every sign of, like, the muscle deterioration, the bone deterioration, and you are gonna tell me you're on PrEP? You're not. Okay, girlfriend, don't lie, okay? I know you hate the stigma attached to HIV, but come clean and be real. You have it, you got it, because of actions that you did or actions that you didn't do, but just be real, okay? And stop lying. And I mean, I'm sorry to say that, but I mean, like, I have to give a lot of young people a lot of credit for being in this new world that is that was handed to them in these conditions. I mean, with systemic racism, with COVID, with there's just so much that was just they inherited this world, and now they're trying to make heads and tails of it. And I have a lot of nieces and nephews. They're all in their 20s, and I'm not ghosted by them. So I understand where they're coming from,
but let's bring the conversation back to what we.
I'm gonna bring it back just with this right here, and it's gonna be on everything that just said about the 30 and older. I came on this to talk about it, but it has one person who could speak on it who's actually 30 years old.
Hi. My thing with this whole, I'm Yafi, by the way, if y'all don't know. My thing with this whole, the problem is we're picking and we're choosing to blame each other. I'm 30, and for me, I would say I'm in the middle to where we have the older generation that do the same thing that the young generation do, and the younger generation do the same thing that the older generation do. When it's piggyback to off of what everybody's saying, you have to take your responsibility for you. Regardless of HIV, regardless of COVID, everything is everywhere. We all know that regardless of what the government is giving us, regardless of what the government is not giving us, we all have the opportunity to know what is in front of us, what we need to do to stay safe for ourselves, to prevent or to protect somebody else. But instead, the conversation keep getting turned on both directions, because instead of taking the responsibility that we all do when it comes to Jack, when it comes to Grindr, when it comes to Tinder for the straight world, when it comes to, you know, these websites, these parts. I heard everything that y'all say, and it's both ways. Y'all, us as people, individually, we might not go through it, but it's a bigger picture that it might not happen to you, but it happens in Brooklyn. I live in Brooklyn. It's Lincoln Terrace Park up the street. You walk through that park, you will have a field day. But it's the sad part of it is us as individuals not taking the responsibility that we supposed to take and not wanting to own it and fix it. That's the narrative of change the whole narrative, and instead of shaming each other and things, let's come together and figure it out. Because don't get me wrong, you can't have the conversation about HIV when nobody's really caring to have the conversation about COVID. You can't have the conversation about COVID when nobody's willing to have the conversation about HIV, because they're both something that can kill you. They're both something that came in the way of pandemic. Yeah, they both came in a storm and took out massive people. So for some, older and young, we got scared and we back away and we take these precautions, rather if you spray somebody down, rather if you use gloves, rather if you stop touching things or not. But then you have these people that just don't care. And I in a sense, I kind of agree with the, you know, I get that itch and I get that urge, but is that itch or urge worth your life? Is that itch or urge worth you going out here to purposely knowing that you're going to harm or put somebody else in a certain kind of situation to where it can mess them up? Like, come on, that's just for me of what I think and what I see.
Speak, John.
For some people it is, right. There's other factors, right? Mental health. I mean, even during COVID, have definitely, honestly, just like HIV, made people wanted to live more and say, wait a minute, if this is going to be it, then let me do what I think I want to do. And I don't think it's that, I think some people are conscious and not conscious about risk or et cetera, but it's also too misinformation that being placed out there, right? 6 feet apart. What's an appropriate mask? What's not an appropriate mask? Wash your hands 20 seconds, different from 10 seconds. So many things. If I know that you haven't been 6 other places, I haven't been 6 other places, then we're good, you know. So there are so many other factors that, you know, we're putting COVID on the top, which again is a still learning disease that we're still learning about. Now, can we put old practices to this new world era? Absolutely. Is it? Can we adapt some of those old practices? Yes, we can. But that in itself, we have been, and I know for me, what I can say as an HIV positive person, have been taught to live a certain way because I am in control of this disease. It's my responsibility for everybody else's healthcare. And now I'm, you know what I'm saying? I was taught how to live. And once I realized that this was somebody trying to control my behavior because they thought that I was being irresponsible, not giving me the proper tools and being transparent with the information. That is what I don't want to see what happened with COVID. I don't want us to say you're irresponsible for not wearing a mask. You know what I'm saying? People have other alongside things going along to where a mask will work, a mask may not work. And so what I'm getting to say is that we're all learning through this new process, and policing people's behaviors is not going to fix it. Making
Can
sure
I say something?
Yes, go ahead, Jose.
From the beginning of this pandemic, talking about COVID, one of the things that I think created a lot of conflict as far as people's behaviors was the misinformation that was out there.
Absolutely.
It was really horrifying how the information changed every day. One day you could do this, one day you couldn't do this, one day you should do this, one day you couldn't. Oh, we can now go back to this. You can't do this anymore. You know, touching on what Chris has said, the younger generation, right, felt this sense of superiorship because in the beginning it was led to believe like they were kind of immune to it, like they weren't getting sick. So they had this carefree attitude, and they went on, you know, they went on with their lives like they didn't go, well, I'm not gonna get sick, who cares, you know? So there's been a lot of miscommunication, and this is all I think on the fault of the government and the CDC, because I think that the information should have been gathered and accessed before putting it out to the public, because when you're putting one thing today and another tomorrow, and this one is contradicting what they said on Monday, and here we are on Wednesday, and then on Friday, it's a collaboration of just confusion, you know. So you have people that, okay, well, maybe in the beginning the mask wasn't necessary. Now it is. But then you have those people that still believe that the mask is not necessary. Then you have those people who do. Okay, well, we're gonna err on the side of caution, right? So one of the biggest issues I think here, and that ties in with sex and everything else, is that the communication that we have been given hasn't exactly been stable. Let's use that word, right? So we really don't know what the truth is when it comes to COVID in reality, because you can, I mean, they have this video going around that an infected person touches everything and practically the entire room becomes infected, right? So you really can't come out of your house if you want to be safe. You have to like just wrap yourself in bubble wrap.
But that's what, can I piggyback real quick? I'm sorry. That's what was said. And that's where it comes back to, again, us as people. Like, you know, again, we didn't have all the accurate information, but facts is facts. When you see somebody is dying outside because they're telling you to stay and stop the spread, why couldn't we just stop being hard-headed and do that? Because
let me finish. So the thing is, every individual is different, and everyone processes information in their own way and form. Some people are more rational. Some people, again, err on the air of caution. Some people are just daredevils. They're okay, whatever. You know what I mean? So, but at the end of the day, I think that the information has had a lot to do with influencing people's behavior. That's all I have to say.
Well, I want to say this before we go on, because some of this is really starting to turn very judgmental. And I think what's running through my mind as being an older person, right? I'm getting ready to be 55. And I remember those days of, you know, the early days of HIV and AIDS. And one of the things I often, you know, raise the question to health departments and community-based organizations is, what did we learn? What did we learn from HIV and AIDS as we're having these conversations about COVID? We learned that stigmatizing people about having sex with condoms and stuff didn't work. It didn't work. It didn't prevent people from still having sex and doing what they wanted to do. It didn't, the fear of it, yeah, people were scared. I remember people didn't want to eat off the same plates or drink out of the same glass or use the same utensils and stuff. And then, you know, in the beginning, and then that died down. And like I said, trying to guilt trip people about wearing condoms or not wearing condoms and all of these safe sex practices and stuff didn't work. So here we are talking about COVID. I don't think that stigmatizing people about who has a mask and who doesn't have a mask, and I'm wearing gloves and I'm not wearing gloves, stigmatizing people, that doesn't work, right? If we're gonna talk about people engaging in sex, I think people still have to take responsibility for their own actions, because in order for us now in the age of COVID, right, are we supposed to be social distancing as well as wearing the mask, right? You not necessarily are having, how are you engaging in sex if you're social distancing with somebody, okay? So that's the situation. We have to be honest and say people are making adult choices or making choices to say, this is what I want to do. Now, there could be factors behind that choice. And I'm always clear to say that it could be depression. It could just be the frustration of being months down in lockdown and needing to have that physical contact. It could, whatever somebody's reason is, I'm not here to judge anybody about it. I really want to just talk about it and say that I think that they're missing the boat of thinking, first of all, that people are not having sex or engaging in sex, and that there is a risk factor, but above all, we're still doing it, right? And that was the same with HIV and AIDS. My question tends to be something, you know, some people prioritize certain things. Now, when I'm saying that, I mean, I know that some people are still taking their meds, right? And some people that are on PrEP, as you guys have all clearly say, you got to be on PrEP every day in order for it to stay effective and continue to work. But then something is still breaking down, because then they're still engaging in breaking social distancing and going to engage in sex, regardless of being sprayed down or whatever the process is, which I am loving every minute of it. I don't know. I'm here for it all, honey. I'm here for the conversations. I like the idea what London was saying before he had to leave. He made it all part of a sexual fetish, but we all gonna wear leather and we're gonna wear our mask and we're gonna do this and do that. That's very interesting. That's a creative way to say, I know that I'm gonna, or a responsible way to say, I know I'm still gonna wanna engage in sex and do that. And how can I turn the situation into something that might be a little bit more fun, or interesting, or part of a lifestyle? But we all are aware that everybody is not doing that, right? And let's just have a real talk about it. People are taking chances. People are going to sex parties. People are going bird watching, which I am still want to know how that is working. Yes, Christina, raise your hand again. Still going bird watching and watching people do what they got to do. The mask got to come off, all that crowd. And
you put a face to it. I'll take you one day.
You took the mask off?
Huh?
You took your mask off?
When I'm engaging.
Okay.
When I'm about to engage, yes.
Okay.
Of course.
Okay. So let me ask you.
I can't do nothing with the mask on.
No, so I'm gonna ask you a question. I'm asking you a raw, honest question. So you went bird watching. The writer went tweet, and you decided that you was going to have some chicken. You was going to munch on some chicken. And then after you munched on the chicken, did you feel guilty afterwards? Did you feel?
No. I took my sanitizer on, cleaned my hands and stuff. Put a mint in my mouth and kept it going. And kept it going.
Like, how did you sanitize your mouth?
No, I said I put a mint in my mouth. I said I sanitized my hands because I was touching them. What's that?
Child, a mint.
And kept it going. Yeah, I don't know what that odor was. So I put the mint in my mouth.
New York City gave a guideline, right? And so sometimes the information is just not getting trickled down to people.
Well, I missed that health note about the mint. So I'm going to go out and buy me some lifesavers. But to explain what the mint was supposed to be protecting you from.
Well, it wasn't just protecting.
Huh?
It wasn't like protecting me. It was like, I didn't have the Listerine to rinse my mouth. So I put the mint in my mouth. You pass it from side to side, left and right, and stuff. Then you do that first bit.
COVID.
And then you went
stuff.
And then
you did actively moving. Sometimes I stayed to see the movie scene and stuff. Yeah.
Okay.
It's a unrealistic, not unrealistic. It's a case by case scenario on how people are assessing their risk.
No,
I agree.
It's how people are
during COVID.
Everybody takes a risk. It's about how much risk are you willing to take.
For some people, it's funny,
now,
right? Some people are manic. Some people necessarily need that human touch.
Now I'm gonna say this after Jallo finish.
And not everything needs to be sex. I know that some people just need another human being to just have a conversation and just to be around during this pandemic, because a lot of us that are in the LGBTQI community and plus, say we've been already estranged from our family and isolated. So our chosen family have fulfilled that void. And now I can't even talk to my sister and really key, because that is something that helps me move on to my day-to-day, can easily transition to be like, all right, he 2 feet away. And I'm gonna get my fulfillment in that way. And so this COVID have either introduced some new behaviors or actually activated some old ones that you wanted to leave alone.
I'm so glad you said that. I want to piggyback off of that completely. Like we said from the beginning, that through COVID, having sex and all through this, I see it as choices. For me personally, living with HIV for 12 years now, in this age now, you could just say at least a year ago, I've dealt with anxiety, I deal with depression, and I deal with heavy drug use. Through all of that, I wasn't thinking about myself. I wasn't thinking of myself, just as Dad said, I needed fulfillment. I know that for a fact now, I needed fulfillment. But I was looking in the wrong places because everything I was dealing with. Now that COVID come in, it changed, for me, it changed a lot. It changed my perspective on a lot of things. That's why I say we were all given the same opportunities in this. The choice that you made with it is you have to live with that. The choice that I made with it is this on me on being completely safe. Knowing that I had a mother who just died from this shit. I don't want to be out there looking, knowing I need that, when I got that itch, I want to scratch. I'm going to put myself at risk going on Jack, Grinder, Adam for Adam, and all those. I don't use them, I never use them. That was for me. For others, they might do that. I met this man here. Through me living my life and being a chef and cooking. We never kissed, never touched, never did anything while I was in a relationship at the same time. Meeting him, being completely respectful. COVID happens, things happen, relationship gone. Me dealing with COVID and being in quarantine, as we all were, we sitting at home, watching movies, smoking if you did, beating off every other time, yes, you can admit that, but that companionship, don't do your eyes like that, Dad.
I'm getting all into it. Looking for the
But wanting that companionship, you start thinking, am I gonna risk this just because I'm gonna get a nut? Me, personally, no, because that's what I was used to. Getting a nut, it didn't feel like anything. I wanted something long-term. I wanted someone who thought, just like me being in this pandemic, who had the same mindset of we need to still be safe, but also know I got an itch and I want it to be scratched. And I don't have to keep going out, putting myself at risk to scratch that itch. And then me at the same time knowing I can't jump into a relationship, but that's what I want from somebody at that same time. So we as two consenting adults agreed we're not in a relationship. We've been hanging with other chicks through 6 months, through the half of the pandemic and through this time now, 6 straight months. We're single. I'm single. He's single. We have a choice. I can fuck who I want. He can fuck who he wants. But we chose and choose not to. Everyone can choose that if that's the case. But there's sacrifices that have to be made. And it's sacrifices that I don't think a lot of people want to make because they're so used to certain things. And that's a big thing of just stepping out on faith. This is what I want. I know there's many people out there that want the same thing. Let me see if this person wants that. Nothing beats a failure but a try.
But
I know he's safe. I know
wanna
I'm safe. If he want to walk off, I can walk off. But we know at this time right now, my itch is being scratched and I'm good money.
Christina wanted to.
Wait a minute, Christina wanted to say something. Go ahead, Christina.
I don't know what I wanted to say now. Let's see.
You better jump in.
I'm trying to remember. Oh, this is the one thing. First of all, I guess the itch. I like porn, not porn on the movie, but porn in real life. I like to see that. So of course, when the Peep Show was closed, the bathhouse was closed, the sex party was closed and stuff, and now we in the epidemic and stuff. Well, I had to resort to what we knew from way back in the day. Go to the park. And you see, the park is still pumping through this whole epidemic.
That kind of floored me, though.
With all that, I'm gonna say this. When I am going to work in my field of social work, I do get tested before I go into work.
Okay.
So that's it. So that's what I wanted to say.
So, I'm gonna turn that back to you then. So then, every time that you engage in bird watching, how frequently after occasions or interactions do you go and get tested?
Oh no! That's only when I'm going to work. That's it.
Okay. So
only when I go to work, and that is once a month.
okay.
Yes.
So once a
So
month.
in between that month that I am not at work and I am interacting with people, well, by the time that month comes, I guess I'm going to find out
Let me
because I'm going to work.
let me ask this question. Let me ask this question to you then. So during that, you have this month stretch before you work. Do you not feel any sort of worry or knowing that with that risk that it's going to be many days from that incubation period to where symptoms show up that you might be infected
Yeah.
or you could get infected?
Yeah, but I'm not going to put that on myself. Yes, it is, but I'm not going to put that on myself because if you put it on myself, then it's probably going to happen. Oh, no, it's not. Not here.
What do you mean?
Not here.
So can you say this? So can you say this? So doing that being said, that risk is exciting to you towards it, right?
I think
it
so.
makes it more exciting.
I think so. Yeah, I think so. It is. I have to still live. I have to still live. I can't be in the bubble. You know what I'm saying? I was already for those couple of months when they was trying to figure out. It's like, now what? Okay, you know what? If it's my time, it's my time. I'm sorry. But I'm going to go happily by doing what I wanted to do.
Go happily. Okay.
That's it. Reading the girls, going to the park, you know.
I think Christina, you bring up a pretty interesting point as far as like if we're going to talk about the accessibility to sex, right? The option that gay men have, whether being in a relationship, you know, parks, bathrooms, hookup lines, apps. You know what I'm saying? It's available, right? And so when COVID come in to make it seem like it was going to be a shutdown, or some people mind frame would to be like, I need to make sure that at least these avenues are still open,
right?
So that I can still have the access to it. It's definitely an interesting point. I know for me, I mean, I was just like, I think honestly, it really wanted to activate my holism because I was like, wait a minute, I don't want to go without at least the last night. Like, you know, I was like, well, shit, you know, like, what if this person ain't gonna be here no more? Let me go try to find it now. Have I engaged, or should I say, let my thoughts, you know, play on my thoughts? No, because I'm just like the other side. But it definitely was those thoughts was in my mind, like, well, what if they no access anymore? What am I to do? So I think that's definitely an interesting point. If we're talking about like Christina being locked down and saying, well, I'm just gonna go live now, or make, you know, that there are several avenues that I knew that was gonna still work.
When is the last time you had a date, Jallo?
Hey,
you tried that.
No. I'm just saying.
You tried that.
The last month. You talking month? You talking 2 months? You talking 3 months?
We're talking years.
Oh.
That's what I said. It made me.
Yeah.
I was like, wait a minute. What am I holding out for?
The real question was, when was your last hookup?
Right.
That's the real question. When was your last hookup?
Years ago. Shit.
So you haven't had sex this whole pandemic?
No, I haven't. I'm trying not that to come out, so I won't seem like I'm absolutely in the conversation. But I haven't.
Oh, okay. We're gonna click you off this conversation. Okay. I'm just kidding.
Now that right there is a great thing. I think that too. A part of this conversation that should be narrated in is as a lot of people don't know how to be okay with someone else's choice. Just because that person made that choice, don't mean that I have to dislike them or talk about them or belittle them or feel some type of way about it. It's okay, that's your choice. Let's just be safe. That's not going to hurt me. It's just in a sense that when it comes to talking about the conversation and engaging in the conversation, more so rather if whoever feel the need to put that out there, long as you did your part to, you know, be safe and try to, if you see somebody in those situations of, I'm going to slide you a condom, cousin, just because I know what you do. You ain't going to speak on it, but be safe. It's okay.
Just gotta own your life. You gotta own it.
Hey,
That's-
I have to say goodnight to you guys.
I'm about to actually wind this down. So what I'm going to do right now, so before you go, is does anybody want to give some final thoughts to this conversation around dating and sex and HIV and COVID? Some final thoughts. So I'll start with you, Jeffrey, since you got to run. What's your final?
My final thought on this whole pandemic and everything that's going on is that we haven't received that much information about what this whole pandemic is about. We have to use our own discernment. Whatever it is, and we have to stop discriminating against your way is better than my way, your leather way, London's leather way, my spraying people up and down is different. Yeah, we all have our own ways of doing this thing and dealing with this thing because we don't have enough information coming from our government. So I think that the best way to handle all of this and the best way to get through it is if we all agree that everyone's going to handle it the best way that they can and they see fit for themselves. Absolutely. They know the risk and they know what can come of it. So we already know the worst case scenario and we already know the best case scenario. So now it's just navigating how to live with this virus, just like we live with HIV. You know what I mean? Like, how do you live and navigate life and still live with this virus and still have sex and still, you know what I mean? Eventually I'll get over my fear and stop spraying people down.
And listen, and I'm gonna tell you something. I'm laughing because it's funny. I wasn't expecting anybody to say that they were spraying people with alcohol. And then when you said it, I got this whole visual because you also said that, you are predominantly a top. So I started to think, who was bending over, spreading their cheeks for you to spread them and spray them? I don't know. I got this weird visual. But if it's working for you, there are some hot assholes running around. That's all I'm thinking about. That's the visual in my mind.
Well, I'm not spraying the inside of the hole, okay? I'm spraying the outside. Okay.
But the fact is that they're letting you do it is the part that's getting me, honey. It's like, okay, it works for you. It works for you. I'm still having that visual of somebody bent over saying, spray me. I'm sorry. It is what it is.
Well, honey, mine comes with oil and it also comes with a nice scent. So it's like you know what I mean? But it has a lot of alcohol in it so that it also kills the virus. So I make a nice one. I mean, it's like aromatherapy kind of spray.
Since you are a former porn star, you can understand the power of visuals. So the next time you decide that you might want to record that, I am interested to see that. I really want to see that bitch bend over and you spray them. But anyway, we'll talk about that later. Anybody else?
Why don't you come over and I'll spray you?
Ooh, wrong candidate. Anybody else got last thoughts?
I would say for just be safe. To agree to disagree. Overall, don't be a Karen. Don't be a Ken. More so just protect yourself to protect others and just live your best safe life.
And just continue to be mindful. That's all. And know your risk.
Christina, you got last thoughts?
Yeah, live. That's it. Live. Yes, live.
Okay. Jay.
Yeah. My last final thought rather is pretty much everybody kind of said. At this point, we're reopening, or we have called ourselves reopened, right? So with that being said, because we have certain things somewhat under control, we know the protocols that are out there to protect not just ourselves but others. Use those protocols. Use your discernment. I don't think that we should completely cut off sexual interaction at this point. Rather, maybe during the pandemic when it was at its height for us, just because it was killing off thousands. Now that we are at a place with a little bit more in control, and although we're supposed to social distance outside, as someone who has been on the apps and things of that nature, I think for me, the game changed in terms of actually having conversation and vetting out your partner versus just the instantaneous hookup in that sense. So while I'm not yucking a yum for those who do hook up and want to meet like right now type thing, but in essence, you can at least use the tools now to have further conversation, because we're at this point where COVID is in our forefront. So we do kind of want to do the screening portion. And in addition, getting to know one another. That's the part that's been taken out of this whole pandemic situation, is the social aspect. And that's the part that I can see definitely why people go out and still want to hang out, or go out and still want to have sex. Me, I ain't really have that. It's probably only had sex one time that I can even freaking think of that's not myself. So with that being, but I've talked to other people in that regard. I'm just very picky naturally without COVID. So I haven't had that type of sexual interaction. Anyone else, use your discernment. We have the tools. It's the same thing I say with HIV. You want to have sex with someone who's HIV positive or whatever, know your information. Know what U equal U is. Know what PrEP and PEP are. Do you. Like, the information is out there. So long as you use it correctly, do what you have to do. And that does include condoms, you know, when it comes to sex and things of that nature. Once again, just get the correct information and live your life. That's my final thought.
Okay. Jose, you want to give a final thought?
You said final thought, girl, not history.
Let's see. Well, you know, we have survived the AIDS epidemic, and now we're entering this pandemic. I think that we should take all the knowledge that we've acquired from both and just continue to live our lives to the best of our ability. You know, just be mindful and be careful, and always err on the side of caution, and, you know, think of the next man. Think of your family. Think of your neighbors when exercising, you know, your judgment. But live. I mean, this is going to be around for a while, so we're going to have to adjust and modify our lives as necessary to continue forward.
All right. John Love, your final thoughts?
I want to say that we as human beings be very cautious on how you talk about COVID. I myself contracted COVID, have my antibodies, wasn't aware, so I tell everybody, I wanted to tell everybody, please get tested to see if you're currently, or if you have antibodies. And it's all in the language. Let's not continue to stigma on anybody's health condition. Let's be very mindful that we are human beings that still have to have humanizing experience. And if somebody pinch you and it hurts, just understand that talking about an illness that somebody been experienced in a negative way still does impact them. So let's just be very mindful how we move forward, how we re-strategize, and how we continuously love on each other.
I love that. Anybody else? Anything else anybody want to add to that? All right. This was a very, very interesting conversation. I thank you all for engaging in it and enduring this whole thing. Happy Black Pride, everybody. And I hope to see you all at the brunch on Saturday. It's at B Square in Harlem. Come on out to brunch. It's going to be an amazing drag show. And on Sunday, tune in to Songs for Marsha, which will be up online on the Facebook page. It'll also be on the website. Songs for Marsha is an amazing off-Broadway show that we do in tribute to the trans community. So this is some of the best girls that perform in this theater space. So yes, enjoy Black Pride, be safe, and love you all. Take care, and thank you. Bye.